This is John Garrett Hall performing my IV primary for nursing 130 with Dr. Brooks. For this, I'm using normal saline. I would have already checked the orders to make sure there is one for this patient. I would have also checked my two checks. It's the patient's MAR, and then when I'm grabbing the actual fluids for him. And then I would have also made sure he wasn't on any fluid restrictions or has like an abnormally high sodium level. So as I'm coming in, and hygiene, introduce myself. I'm Garrett. I'm your nurse. I have your IV fluids today. I'm going to go ahead and verify using two patient identifiers against their wristband, name and date of birth, Donald Duck, February 2nd, 1940. All right, Mr. Duck, this is your IV fluid. Normal saline is going to help keep you hydrated, and it's also going to keep that little IV line open for us. Check and verify that there's no sedimentation. It's still nice and clear. It's not expired. Medication is good to go. Verify that against the patient's MAR again. 0.9% NaCl, 0.9% NaCl. Good to go on that check. So while I'm getting this set up, you can go ahead and start the machine. Let that get going while we get the bag set up. My bag. No new patient. Med surge, yes. Got my bag. Got my tubing. Take the tubing out, making sure it doesn't touch anything. And I'm going to make sure that this clamp is shut so I don't lose any fluids. Take the cap off the bag. Take the cap off of the spike, making sure not to touch the spike or the opening for the bag. I can now spike the bag. Go ahead and invert it. Make sure I fill up the drip chamber anywhere between a third and a half. That looks good to go. Hang that. And then I can assess the patient's IV site, making sure it's clean, dry, intact. I don't see any signs of infection, inflammation, infiltration, phlebitis. It looks good to go. Checking with the patient, is there any pain, tenderness, warmth around it? Nope, we are good to go. Okay, so now that I have the line spiked, I can go ahead and prime the line, making sure there are no air bubbles trapped inside. Going to slowly open this up and watch as the fluid fills the line. Okay, and then I'm going to go ahead and go one more time, just make sure I don't have any bubbles anywhere that I need to clear from the line. Okay, and that looks all good. So now I can go ahead and go to the patient's IV site again. I'm going to clean it off for 15 seconds. Vigorously scrub for 15 seconds, getting the top, the sides, all of it. Okay. Now I'm going to go ahead and make sure we have a paint IV site. Take this, make sure all the air is out. Aspirate for blood return. And go ahead and flush, not pushing past any resistance, checking with the patient. Is there any pain, any burning? No? Okay, good. I'm going to go ahead and leave that. Got my line all prepped over here. Now I can connect the patient to the line. Making sure this clamp is open. Now insert it into the pump. Blue to blue. Close. Make sure this clamp is open. Now channel select, guardrail, IV fluids, page down, normal saline, yes. The rate, again, the patient's MAR says 125 ml per hour, rate 125, volume to be infused. This is 1,000 milliliters. I'm going to say 950 to make sure I accommodate for what is already in the line. Plus, it'll give me a little extra room at the end to make sure the line doesn't dry out before I switch out the bag. Go ahead and hit start. Make sure my clamps are open. And then I'm going to sit here and wait for that first drop, and I see it. So that is good. Now I have to label everything. Date, time, and initial. 327. Time is 11:20. And the initial. And then I also have my tubing label. I will now hang or stick onto the tubing to make sure it gets replaced, changed out at the correct time. And that is it for the primary.